Okay, and we should be now live on Facebook, and we're also recording to upload this here to YouTube here shortly. Good evening, everybody, and welcome to the Dr. Theo Show, your official show where we don't have any sponsors, we don't make any money, really just investing a lot of time in doing what we're doing. And this evening, I have a guest that I have been looking forward to for months. You may know him. He's now also Greenville famous through social media outpourings, newspaper articles, TV interviews, and now welcome to the Dr. Theo Show, Dr. Daniel Lewis. Can you introduce yourself, sir?
Yes, sir. Glad to be here. This is my probably the most awesome invite I've got to this point yet out of all the others. So I'm glad to be here. My name is Daniel Lewis. I'm a family physician here in Greenville, Tennessee. Have been here for about the past 12 years and am also a COVID survivor at this point. So
now, the point of our interview here today is not to hash out all of the terrifying details that you shared last night on your own testimony of everything happened. But I do think it's important. You know, there are people that follow the Dr. Theo Show from various parts of the country. Of course, a lot of them here in East Tennessee. And so, Dr. Lewis, if you don't mind, at least for people that don't know you at this point, if you could summarize a little bit about what you went through, and the main focus for this evening is kind of going to be going forward, what to do, and hopefully having a group of smart, educated people, not that we know everything, but talking about, hey, here's what we need to do, because everybody's confused. So if you could tell us a little bit about your experience, and we'll just kind of wing it from there.
absolutely. So my experience, I would say, with COVID began in March of 2020. I was helping prepare our local hospital system for the onset of what we thought and what actually did develop to be the first wave of the pandemic. During that time in early March, we were prepping our system and getting ready for that. But during that time, I was exposed to a coworker who had been traveling a couple weeks previous and came down with COVID at that time. We had some interactions together enough so that I gained symptoms from him, and I developed COVID and was tested positive at the end of March 2018. Had a few days at home and then went through essentially a month-long hospitalization where I was in the hospital, spent 10 days in the ICU on a ventilator, mechanically ventilated, supported by life support, and then another 2 weeks in the hospital recovering from the sequela from that, along with some side effects that occurred. After my discharge there, I spent approximately 7 days in a rehabilitation hospital here in Northeast Tennessee and returned home May the 9th, and have spent the time since really recovering and getting back into the workplace and getting back to my full-time work with patients and with the hospital here in Greenville. So,
Yeah, you know, I'm almost thankful you skipped over the coming out of the hospital, heading to rehab with your children holding up the signs, telling you how much they loved you. Because I saw that. I don't know if it was live or right when that happened, but you know, even when you talked about that last night in your testimony, you know, I started bawling, man, just to be quite frank.
yeah,
I'm going to try to hold it together right now, but you know, I can't imagine. You know, I've got 3 boys. You have, you know, a whole litter of children. I mean, I can't imagine going a month, much less 2 months, without just grabbing those little guys and girls. I mean,
yes, I mean that, and you know, I've shed more than a few tears myself about that. You can only imagine. It took probably a month so I could watch that victory walk without crying. It was incredibly hard, and that's one of the things I think that, you know, as we go through this, I mean, people seem to have a flippant attitude about this virus just in general, and are saying, well, the death rates aren't what we expected, and people aren't dying. And absolutely, I did not die. I was at that point one of the 3 to 10% that came off the ventilator when they were ventilated at that point, and I praise God and thank God for that daily. However, you know, yes, I did not die, but there were significant issues that occurred and side effects, not the least of which was isolation from my family and not being around them for a period of time, and things that people seem to say, well, I'm not going to die from the virus, so let's just do it. Yes, but there are lots of things that happen that are very difficult on you and your family thereafter. And that isolation was incredibly difficult. And I'm thankful every day I do get to grab and hug them now.
Yeah, you're actually one of the reasons I kind of started doing a lot of what I was doing. I was already sharing articles and other types of things there too. But, around the time that you isolated yourself, I actually did myself, did the same thing. I moved into my basement, not because I'd been exposed. In fact, to be perfectly honest through all this, to date, I have not seen one coronavirus case in any of the 30 or so people I've swabbed or people that I've sent to the health department. That's why I have time to do this, right? Because I was isolated in my basement. I started that kind of stuff up. And then, of course, once you got to the point where you were not able to lead here in the community, being in the hospital sick and on the ventilator, then kind of our community's been hearing my voice through all this. But what I would like to stress to anybody listening here is, Dr. Lewis is a graduate from East Tennessee State University, the Quillen College of Medicine, as am I. We are both, we're not infectious disease experts from this, CDC or other major institutions, but I feel like we are overall decently qualified. We're both family doctors who care about our communities, and what I would like to do is first of all, we've established credibility, right? Sure, not every single doctor in the entire country is on board with taking this seriously, but the vast majority of us, I feel like, are. And so you're not only an expert in academia and in all your leadership in the hospital, you are the chief medical officer of our local hospital at Greenville Community Hospital. And you're also an expert from having gone through this, right? And so I don't think there's any point of addressing the question, is COVID real, right? Because that seems to be the question over the previous few months, is this is some kind of political conspiracy to damage the incumbent leaders to get reelected, and if this wasn't an election year. And I feel awkward for even having to address that, but that seems like to be the elephant in the room. I mean, a few weeks ago, for example, I put a post up that recommended people not visit Myrtle Beach or Sevierville Pigeon Forge. I'm looking at numbers and seeing 5% tests coming back positive, and then 10%, and then 20%, and then saying, whoa, hey, it's not a great idea to travel to these places where you have a ton of people coming in. And all of a sudden, that post went viral. People are messaging me, calling me a Democrat, saying that I watch CNN and MSNBC. They're telling me I need to go educate myself, and I need to stop being paid by Big Pharma and Dr. Fauci and all these other types of things. And first of all, that doesn't get to me, because you can't fix stupid. But how can we at least, I don't know, get people to wear a mask or wash their hands, or at least care about this? Do you have any ideas or suggestions?
Well, listen, Theo, I appreciate all that you've done, and you really have done an amazing job stepping up in this community and being a voice of very much what I think is reason and a balance. And I very much am appreciative of you doing that and taking that on during the time that I was ill. And again, you're a leader in this community and well respected. And I think far and away the majority of people do respect that and respect those views dramatically. I saw your post. It was 100% spot on. Absolutely was the appropriate thing to do. And people don't realize that with these type of tests, when we're looking for diseases, there's concern raised when we get over about a 2 to 3% positive rate. I mean, it means that we've got the presence of the community. When you're bumping up against numbers that are 8, 10, 12%, I saw a couple weeks ago, I'm from Carter County initially. Carter County had 8 cases out of 8 swabs. 100% were positive. In Greene County that same day, I think we had 8 or 12. We had a 64% positive rate. I mean, at that point, we're not sampling any longer. We're just confirming things. And that means the presence the disease is so prevalent in the community. Likewise, I've been frustrated by the things that you have been as well. I mean, and as I've said in a couple of my posts, this virus is not Democratic or Republican. It doesn't care what flag you wave. It isn't going to ask to see your voter registration card before it decides to infect you. certainly I think that there's a political debate that is on both sides of the coin. And unfortunately, in today's environment, that politicians, incumbents, seem to want to utilize anything that's there for their potential favor. And so you see both sides kind of gaming the system. But, when I see suggestions that people are putting in false tests, I saw a post that said that nurses were creating 10,000 false tests in South Carolina to put into the system. And as I said in the post the other day, you can't order a diet in the hospital without me signing it 3 times. I mean, you can't create 10,000 additional swabs to flow through the system, not paired to people. It's just impractical given the checks and balances that we have. And the faith that it takes to believe those type of things, to me, is much greater than the faith it takes to believe that the virus is present in our community and we need to do what we can. Certainly, it's an infectious process. We can't prevent everybody, but to me, wearing masks and social distancing seems to be the least that we can do, and in order to try to prevent and contain this virus.
Now you hit on probably a couple of the most controversial things here right now, and that is, I think, general public distrust in what information they're getting. Right. Now people are frustrated with information they're getting, and that things are changing. Now, those of us in medicine realize that happens all the time, right? Eggs are good for you, and then another study comes
out, eggs are bad for you,
and they're bad, right? And then they're good and they're bad. So eventually, as a consumer, you throw your hands up and say, well, I like eggs. I'm just going to eat them and take whatever cholesterol medicines I may need, right? But in all seriousness, I get people being burnt out on information, and people are making this political and all those types of things. But I just really wanted to echo your point of testing, because that seems to be the hot topic for right now. And if you're listening and you're out there and you're hearing these kinds of things, just use your ears and your brain for just a moment and realize that, yes, there are people that will rarely do something wrong or falsify or write something wrong down on a certificate. You could have one example of someone actually doing that, and that being a teeny tiny fraction of the entire picture. So, we're not saying here that there's no fraud or there's no people that do things they shouldn't, but what we're saying is that the vast majority of this testing can be trusted. Now, some people talk about false positives and other types of things. And yes, that's a big deal. Sorry, I've got a baby coming in the room. Yes, that's a big deal as far as, if there's a 1 out of 100 or so that could be a false positive, but also the false negative rate's a big deal too. And, from what I'm seeing still in nasopharyngeal swabs is that 69% of people that are known coronavirus positive, the swabs coming back, a false negative 31% of the time, and a true positive 69% of the time. So to me, in science, that says, hey, we're vastly underestimating these cases. Yep. What are your thoughts?
Well, absolutely. And I think there's always concern in any lab test that you order about specificity or sensitivity or false positives and false negatives. The test is designed, the PCR test amplifies viral particles. So essentially, in order to have a positive test, you have to have viral particles. I've been telling folks that, as we talk, the sensitivity or the true positive rate for this test is about 99%. If they swab you and find a viral particle and amplify it, chances are very high that you have COVID in your body. Now, likewise, that it's not quite as accurate for the true negatives, because it's relying on someone sampling. If you jerk your head back where they try to get a sample and they don't quite get fair enough in your nasopharynx, not that I ever did that over 10 or 12 times, but if they don't go back far enough, or if there's another issue, then yes, there can be a false negative. But yes, we're much more likely underestimating the prevalence than we are overestimating the prevalence. And I've seen that point too. So people have talked about, and I've had reports and people contact me and say, well, but we've got all these asymptomatic people that are testing positive, and so should we really count them as disease? And the answer, of course, is yes, because they, again, if they're positive, they have the COVID virus in their body, which makes them able to spread it. Thank God that they've got very mild disease. And thankfully, still to this point, about 8 out of 10 people will have relatively asymptomatic or mild disease. That doesn't mean they can't be a vector to spread it to someone else, and that we shouldn't account for that. And that those individuals, even if they do say they feel good, shouldn't begin to limit themselves to limit the exposure to others at that time as well. And absolutely, there'll be people walking around with a false sense of security that may have it, that we may not. But certainly, if you have a positive swab, you have the disease, you have the virus, and you need to be careful until it runs its course.
Just a quick update. A few people, I think, had lost some sound. I've changed some settings now, and that should be fixed. The final copy that goes up to both YouTube and Facebook should have both myself and Dr. Lewis in there too. So if you've missed anything so far, tune in here later when I upload that, and we'll go from there. By the way, I am checking out comments, you guys, and if you have any questions for us, this is a great time. We can't give super personalized advice, but this is a great time to ask a question, and there are no dumb questions, first of all. And we'll try to be as open and honest as we can. So as we're talking about testing or treatments or what to do, feel free to jump on, and I'll ask Dr. Lewis whatever your questions may be. Second part of that, Dr. Lewis, is when we're talking about testing, I want to clarify what you mentioned, of course, in science, which I know PCR stands for polymerase chain reaction, where you're actually taking parts of that virus, amplifying it, and then eventually spreading it out along an electrolysis gel or electrophoresis, right? So I think where some people are getting confused on numbers and false positives, negatives are these antibody tests, which, of course, we didn't have anything, brand new virus. We've rushed it to production, and some are better than others. Some require, if it's negative, then you do a culture and it's positive, and there's all kinds of other types of things out there. But where are we with antibody testing? Is that something that you guys are doing, and what does even that mean at this point?
Well, and certainly you're dead on as always. Antibody testing is a whole nother animal, and again, I've seen folks on Facebook or other areas, ascribe some of the concerns about linking to other types of coronaviruses or whatever, that types of antibody testing to the nasopharyngeal swabs or the testing for the presence of the virus. I mean, you're exactly right. Antibodies are still, I think, antibody testing is still being developed. We have our hospital system does have an antibody test available. They've chosen one that has a pretty high specificity for it. So again, it's very specific, this particular one, for the COVID-19 strain of the coronaviruses. And as we talk about, there are other coronaviruses that have been out there before. All of us that have grown up have probably been exposed to a certain type of coronavirus. We've never been exposed to this COVID-19 SARS-2A strain that has enough changes in it to make it what we call novel or new, to where we've never seen it before. This is why the reason why it's so contagious for us, because we don't have any built-up immunity to it over time. None of us saw this virus 10 or 15 years ago. But some of the antibody testing can pick up some of those other coronaviruses, and a lot depends on the specificity of the specific test that you're running. Routinely in our practices, we're not doing a lot of antibody testing. It is interesting that our hospital system did offer antibody testing as we were rolling this out to all of our employees. And we had about, I think, 25-30%, about 3,000 to 4,000 of our employees across the system, across the Northeast Tennessee and Southwest Virginia region, be swabbed for that. And that was more or less from a epidemiologic or public health perspective to try to see, hey, has coronavirus been here? And, while I can't quote exact numbers, our rates of positive antibody tests were less than 2%. So, we've done that within the last probably 2 months. And so really what that tells us is kind of this first wave that we all prepped for, as, not to get political, but as we had shutdowns and as we limited exposure, we did a pretty good job of limiting the exposure of coronavirus. And then it hasn't really been here yet. Now in the second wave, as we're calling it, it is more prevalent in the community. And so we're starting to see it more often. But the antibody testing, I think, still leaves a lot to be desired. I've had some patients request it that have said, oh gosh, I was sick as I could be in February, and I traveled to Los Angeles during that time, and I think I had it. And I've done a few swabs, and I've yet to have a confirmed positive antibody test come back in my clinic out of the 2 or 3 specimens that I've done. So it's just not. I don't think you're exactly right. The PCR, the test to detect the virus, is pretty good, and I would bank on it. Antibody testing is still being developed, and we're still learning. And we're trying to learn quickly in this situation and trying to adapt very fast, and that's going to lead to some less than satisfying, responses while we kind of come to conclusions over time. Just the way science works, it takes some time for everything to filter through.
I've heard that kind of a narrative several times from people. Oh, I think I've already had this. I
Hmm.
think that's kind of wishful thinking, right?
It
You
is.
probably say, I hope I've already had this. And I've even heard this from physicians, saying, hey, I was sick in December or January or February. And, I've seen reports that, of course, not only was flu raging then, but there was uh, several rounds of human metapneumoviruses, parainfluenza. There's,
Hmm.
100 viruses that can cause this. But here a few months ago, when you had these urgent care doctors in California going viral for claiming that some 60 million people already had this virus based on really flawed antibody studies. I tried to push the brakes on all that of saying, listen, you may have 20 or 30% like they saw potentially in a hotspot county, but that's not what we're seeing here. And even if you do get that kind of immunity over that way, we have our pocket here where we have not been
We
exposed
don't have
for
it.
those
Right.
reasons. I
Yep.
mean, unfortunately, I just saw just a little while ago, we're up to 95 total cases here in Greene County for the entire time, which means yesterday I think I saw 85 or 86. So, we're up another 9 or 10 here
Hmm.
today. And now, the next most important thing kind of going forward that I'm hearing right now for people is saying, well, the cases are going up, but the death rates aren't going up. I did a video and I kind of outlined potentially 3 things that could mean. I'd be curious what your thoughts would be, and if you have any other ideas. First of all, the cases are going up, and we're having a month ago, as things are reopening, anywhere between 15 and 25,000 cases a day in the country. Here lately, it's closer to 40,000 cases a day. The past week, closer to 50,000 cases. Florida is averaging about 10,000 new cases every single
A
day at
day.
this point. So one theory I have is why the death rates aren't going up as well. We haven't had enough time, give it another few weeks and we might start seeing that. And then it may just kind of be a premature type of thing where similar back in March and early April, we started seeing cases going up, but it takes time for people to die. I mean, not everyone just dies instantly like they did with flu back in 1918. You may be battling this for weeks and weeks and weeks. Any thoughts on that?
Well, again, like I say you're dead on. Yeah, yeah, the thing about the coronavirus seems to be a little different is the ability to activate kind of your immune system, or what we call the cytokine storm. And that doesn't really onset until 10, 12 days of illness typically. So you're exactly right. The death rate will follow behind the cases that come on. And that certainly will be a very valid reason why. So we're not out of the woods yet. Let's see what we look like 2 weeks from now. The cases start going up and we see where the death rate comes or not. But, as you said too, obviously we as a country have ramped up kind of testing capacity. I mean, it's a little easier to get a test now. It's still not perfect, but previous in March, we were only testing the sickest of the sick. And so when you do that, you're going to have a higher death rate. Now that we're testing more folks that are mild, moderate, or even asymptomatic, it expects and follows that the death rate will follow. But even, with a lower death rate, we've still almost quadrupled the average death rate from flu in this country for a given year, and we're nowhere near the end of this cycle yet. So, and again, I don't want people to feel a false insecurity. Well, I'm not going to die. Well, maybe not, but I didn't die, but this virus took a good 3 months of my life away from me.
Absolutely. So essentially, what we both agree here of saying it's too early to say, right? It's still the
Right.
second quarter or the third quarter. Game's not over. We can't say for certain at this point because we haven't had enough time from these surging cases, right? So
Right.
that's kind of point number one that I definitely wanted to push. Now, let's say here in 3 or 4 weeks, we don't see an increase of deaths. That would tell me potentially 2 things. Number one is that there could have been co-infections with other viruses several months ago. Once again, we were still coming through the middle of flu season. I've heard first-person accounts of physicians that treated people with both corona and flu at the same time back in the spring. And
Yep.
at that time, a lot of times we weren't even screening for both. The guidelines were if you get a flu or a strep, then you stop and you don't even screen for corona. But it happened to
Right.
be some of the sicker of the people, they would screen for both. And then a lot of times they potentially found both or other viruses. So, it could be just it's summertime and some of these other viruses have kind of calmed down. That's potentially one theory. And then the last theory, of course, is, well, we've been fighting this for 4 months now. We can treat it better, right? There's a few things that we know has improvement. And there's a couple people that have asked questions about, treatments and exposure and hydroxychloroquine. We'll get to those here in just a minute. We'll get to the comments and questions. Of the things, at least that I'm reading, and I've interviewed Dr. Ken Nickel, who served up in the Army up in Connecticut near New York, a registered nurse. I've interviewed at least one other patient that's had coronavirus here on the show. And so far, everything I'm seeing and hearing is that the blood clots, which you experienced, is one of the potentially more deadly things. Now we know about it. Now we've shown that by treating blood clots, we're able to significantly lower mortality by about 1/3 to 1/2, depending on the patient and how sick they are in presentation time. But as soon as people are getting in the hospital now, they're starting, from what I've heard, anticoagulation almost as a full dose kind of prophylaxis, not just a low dose preventative because you're laying on the bed type of thing. But those have to lower mortality because we're learning more. Any thoughts between co-infections versus treatments lowering death rates?
Well, absolutely. And again, I think, we're right on. Typically, summer is not we don't have a significant viral burden because some viruses are sensitive to temperature, what have you. I guess we all hoped COVID would be, but it doesn't appear to have significant changes there. But yes, there are certainly presence of other viruses that aren't there now that, again, in the coming months, if we extend this wave out into, the fall, we're going to start seeing flu and other things coming back up. So I think you're right on there. I would certainly say and echo that I believe the treatment algorithms are changing and are different now than what they were. Kind of, you talked about wishful thinking. I mean, my wife has shared with a couple of folks, and she has it saved on her phone to beat me over the head with in perpetuity, I think. But at one point I did say I'd almost rather go ahead and get this early if I'm going to be exposed, if I knew I'd have a mild case. I did preface it with if I knew I'd have a mild case, and I blew right through mild and went on to severe. But the treatment that I received in early March, I had plenty of access. There's plenty of beds available, and all those things were great things. But even after my acute period, my period of convalescence, I was in the hospital. We started changing therapies immediately. I received multiple therapies that we wouldn't use today, more than likely. I did not receive therapies that we would use. Remdesivir, the miracle drug people talked about, I was turned down for it because I wasn't ill enough for it at the time, and now it's routinely used, for example, among other drugs, dexamethasone. So the treatments are completely changing, and I do think as we have time, we'll become more effective. I mean, that's the idea of science. It takes some time to do some trial and error at times, and I got a couple of things that now have pretty much been proven to be an error at this point as far as acute treatment. I do think our treatment is better, our supportive is better. We're not utilizing things as well. I mean, you're dead on about the blood clots. I developed DVT and pulmonary embolism about a week after I came off the ventilator. It was the thought. It's interesting looking back at it now. I had blood drawn, and even drawing through a vacutainer, my blood would clot in the middle of them drawing blood the week after I got out of the ICU. They'd have to stick me again to draw it. So I was very hypercoagulable. And, they went back and began to study, and they thought, well, he's had these clots since he's been on the ventilator. So you're exactly right. The guidelines have now changed. Certainly anybody that's ventilated receives prophylactic full dose anticoagulation immediately, as opposed to the half dose I was receiving just to try to prevent me from laying still and having it. And again, that's starting with hospitalization too. So, we are learning, unfortunately, from some of the missteps we had previously. That's the great thing about medicine is we do adapt and we follow the science and go where it leads. But I do think the treatments probably are much more effective now than they were previously.
Sure. So really, it very well could be a combination of all three of those.
All those things.
The fourth thing that people, of course, say, which is absolutely true too, is a lot of younger people are getting this right now. And I say younger, meaning, anyone to me that's younger is anyone younger than my age, which I'm in my mid-30s. You're in your early 40s, right?
Yep.
But there's a large amount of people in their teenage 20 and 30 range that are testing positive right now. So that may also yield lower death rates here in a few weeks just from the younger, healthier kind of crew. Now, if you guys remember back somewhere in May, I interviewed a corona patient who wanted to remain anonymous due to, at the time, didn't want to freak out people they worked with, I think, or maybe family or things like that. But that was someone who was 29 and was sick as a dog for 2 weeks at home. But also at that point, it's not just that you may be very sick and maybe on a ventilator or whatever else, but you may miss work for a few weeks or a month or 2 months. I mean, that has me terrified. I mean, I've got some saved up for a rainy day fund, for example, but I can't imagine my income loss for a month or two, still paying bills, still having overhead, and a lot of those are the types of things too. So I think people forget about those practical things, not to mention hospital bills and deductibles and all those types of things. I'm sure you've hit your out of pocket for the year, so you want to go ahead and knock out anything else you might need to the rest of the year, right? But also the bigger thing I'm worried about is if a lot of people in their 20s and 30s are getting this, then they're gonna pass that to grandma. They're gonna pass that to someone else that is in the community. So even if we don't have that big rush here in a few weeks, I'm really worried that by mid to late July, then that's who they're passing it to is going to really be a changing demographic.
Yeah, absolutely. And I think those people are very much at risk, which is why I continue to, and I know certainly you beat this drum incessantly, is wear a mask. And it's not necessarily to protect yourself, it's to protect those around you and to keep you from spreading the disease when you're asymptomatic or early in the process to others, and expecting others to do the same for you. And I got into I don't want to say an argument, but a debate yesterday with someone who put up surgical masks that this virus will not prevent you from getting coronavirus. I'm like, you're exactly right, because it's not meant to be a filter. It's meant to block your secretions and your respiratory droplets. And if you expect everyone else to do the same for you, then you should do the same for them. And
I've seen people circling the word not to be used in a non-sterile environment, all these kind of things that are out there. It's wild.
Yes, it's crazy.
What people don't understand is that actually proves why wearing the mask helps, because you and I have delivered babies and done C-sections and through medical school and residency assisted in surgeries. We've been prepped in sterile fields, and the room isn't 100% sterile, but it's close. But the reason surgeons wear masks is not to protect them; it's to keep from spitting into an operating field and contaminating. And that's exactly what we're saying here is. When you're at Walmart, you wear your mask so that you don't spit in to contaminate Walmart. It's already dirty enough as it is without your spit going everywhere.
Exactly. And, exactly. And I don't think I know anybody that's willing to let their surgeon come in maskless to do their surgery for them. But if some of these individuals want to sign up, I guess we could say PPE that way. But I don't think, anyone would be comfortable in that environment. And I think, we should be willing to do the same for others. And to protect others, as you said.
All right, I've got a really serious question here, and then I'm going to go to some comments because we've got some good ones coming in. Okay, have you or any other physician or surgeon that ever died from inhaling your own carbon dioxide from the mask?
I thought I was close once, but no, I'm still here today. I don't think I did not die and resuscitate myself. Again, it's just, if the mask is not designed to be tight enough to completely filter all the viral particles, it's not going to filter out oxygen or carbon dioxide either. So you can still exchange them very readily. I've worn them for 12 to 14 hours at a time. It's hot. It's uncomfortable. Nobody likes it, but my O2 sat and remained 99 the entire time I had it on. So, no, I've yet to hear the report, or I've yet to call a code in a surgical operating room from a surgeon dropping from wearing a mask.
Okay, well, that's good, because of all people, you would know about that. So I feel reassured. Now, in all seriousness, I asked that question in jest, but listen, that's what us educated people kind of respond when we say things like, or hear things like that. We kind of shake our head, we face palm, like, what are these people talking about? The average viral particle has about 100,000 atoms in it, and carbon dioxide is literally 3 atoms. And so if you're saying that it's not going to filter 100,000 atoms, but that it somehow does filter and lead to toxic with 3 atoms, it just doesn't quite make sense. Now, the last thing I want to hit on the mask before we hit the comments here is kind of the droplets, because this is just so important, right? Sure, a lot of masks that are being worn aren't going to filter out the direct viral particles, but that's not what we're trying to do, right? When you talk,
Right.
that increases the amount of potential viral contamination, right? If you spit,
Yep.
if you cough, if you sneeze, that's way more. But can you speak on to how the masks are potentially catching droplets?
Well, absolutely. And I think, that's really key. And again, as you see, you're seeing more and more people coming out saying, and even I'll say I had, again, a Twitter exchange with a surgeon from Knox County yesterday saying, yeah, but if you saw what people are wearing for masks, they're not even wearing real masks. They're wrapping their face with what have you. Interestingly, a study just came out yesterday combining and looking, and it was a simulated mannequin type setting where they simulated sneezes from patients, and just the shredded droplet particles. And they tried all kinds of different things. And they showed that, yes, the average sneeze unimpeded would spread particles actually about 8 feet, 8 to 10 feet. We're saying 6 feet is a safe social distance just to be acceptable. But a sneeze and cough may spread even farther than that. But even a simple bandana wrapped around that face, like we're back in the old West, and somebody put a bandana around the face, decreased the droplet spread from about 8 to about 3 feet. Cloth mask spread it to about 1 foot. A double layered cotton mask made of quilting fabric, so 180 count or higher, spread to about 14 inches. So the mask just prevents you from exceeding those and spreading those parts to each other. If we'd all wear that mask, and if we would stay 6 feet apart from each other, then we could limit the infectivity of this virus. And I've been beating the drum since March. A study I saw respected, as far as epidemiological perspective, said that if we could get 80% of people, 4 out of 5 people, it doesn't have to be 100, to wear a mask and to stay 6 feet apart, we could lower the infectivity of this virus to a factor to where every person that has it will spread it to less than one other person. And if that happens, we'll see the virus extinguish. But right now, the infectivity rate's 3 to 4 of the virus. And so every person that has it spreads to 3 or 4 others. It doesn't take long for that to increase. And I don't know what days you shopped at Walmart or Food City, Dr. Hensley, but when I'm there, I don't see 80% of people wearing a mask, unfortunately. So
yeah, I specifically avoid places that have that low of rates, but also people will see me around town wearing a mask just awkwardly. And to be clear, I have once accidentally been that person wearing my mask when I drove my truck. It wasn't on purpose. I swear, if you saw me and took a picture, it was on accident. I don't think that protected me. It's just I'm such in a habit that that's what I'm doing, and so
all the time. That's right.
Yeah, so that's what we educated people that dedicated over a decade and hundreds of thousands of dollars in student loans are asking you. We are not paid by the government, by some kind of news organization or anything else. This is clear, unfiltered, unbiased news from scientists for you to wear a mask.
Amen. Yes, if you go look up in the Sunshine Act, I think I did take a $4.38 sandwich from Pfizer one time last year.
Oh, yeah, sure.
So beyond that sandwich, I've not got paid a dime, and I paid several $100,000 to share this advice with you. So you're welcome.
Exactly.
Wear the mask.
So there we go. Okay, let's dive into questions. We got some good ones here. Marie Williams, a little while ago, asked, she is a midwife, and she says, I read about a drug protocol for non-hospitalized patients with hydroxychloroquine, losartan, zithromax, etc. And when our pregnant patients are positive but mild symptoms, we treat conservatively and quarantine. Should everyone be put on meds to prevent worsening? She says, of course, I am a midwife, so I don't make the decisions. I consult. Yeah, pregnancy advice, I'm just going to steer clear from for obvious reasons as far as medications, because anything in pregnancy, from a Tylenol to an aspirin, anything else has varied risks, right? And so there's different grades of potential safety based on animal studies and a lot of those types of things. But hopefully people that are pregnant right now are going to take precautions to prevent it in the first place. That's the best treatment, is prevention. But if that's going to be after something we're going to have to figure out. Someone commented on my page a few days ago that they knew of a woman who lost their baby at 32 weeks gestation because of COVID, most likely. And of course, I thought, well, maybe the blood clots, maybe some kind of placental problem there with clotting. So, not being an obstetrician, reading specifically about that, I don't know, Danny, have you heard anything on pregnant patients or anything at that point?
No, I don't have any advice for, specific for pregnant patients at all at this point. What I have seen and what I'm aware of course, is there were a lot of hope and kind of promise about hydroxychloroquine and azithromycin for hospitalized patients. I don't think the study showed that really didn't pan out. I received that combination of medications. It did not prevent me from going on a ventilator or achieving a higher level of care at all. There is an ongoing, as far as I'm aware of, a study ongoing about hydroxychloroquine as an issue for prevention and in the outpatient environment potentially. But again, I certainly can't give advice for pregnant patients in general. Hydroxychloroquine by itself is not a benign drug either. It has a fair number of side effects and risks that come with it as well. So we need to be very clear before we make any recommendations, particularly the combination of hydroxychloroquine and azithromycin, both of which can prolong your heart rate and lead to some heart rate arrhythmias. Both medications have the tendency, both put together have even more of a tendency there. So even when I received it in the hospital, I got daily EKGs to check to make sure there's no issues there, other issues. And they're not benign drugs, but I unfortunately am far enough away from, or fortunately, I guess, far enough away from delivering babies that I don't really feel like I'm adequate to give advice for pregnancy.
Now, let's touch on the hydroxychloroquine specifically just for another minute here, because for all clarifications, obviously you don't have to say anything, but I've been open. I'm a conservative physician, and people will know well that I've pumped off the brakes on the hydroxychloroquine several months ago for good reason, right? We use it for some conditions to suppress the immune system. And that's not necessarily a good thing early on in disease when you're trying to fight something off, but could be good later on in disease when you're trying to suppress an immune response. But essentially, this thing got crazy political because of President Trump announcing the game changer status. And, for me in medicine, I cringed because I said, oh, no, we don't have any evidence.
We don't know that.
That's a terrible idea because now at that point, we've had several studies showing that there's worse outcomes, that you're more likely to die on it. There's several studies that have shown that there's no benefit. And then today there was an announcement, I think yesterday or sometime late this week, about a Henry Ford study that had mentioned potentially half of the mortality with hydroxychloroquine alone. There was higher death rates in combination of hydroxychloroquine with azithromycin. But once again, this was a retrospective study where they looked back and it wasn't randomized, which means they kind of picked and choose. And there's some criticisms of that too. So I'm seeing a lot of stuff here today about, oh no, this is back and it is this game changer. And once again, I'm rooting for the medicine. I'm hoping that something like that really does work. And politically, I really don't care what works and doesn't work. I just hope we're finding something. Now, do you have any other information other than that? Or do you think that's a fair assessment at this point, or am I being political about that?
No, you're not being political about that at all. I think that's very fair. I share your general tenets as far as views on politics and things. And again, same thing as you said, when it came out, I was like, oh no, please don't say that, because we don't know that that's the case. And it's not been proven. I say for myself, it wasn't necessarily effective. That's the N of one. Obviously, that's not going to spread out to lots of people, but there are lots of concerns and issues about it. I'd be much happier about the concerns or the studies about dexamethasone and other steroid medications and things that we're working towards, as opposed to the hydroxychloroquine at this point. But again, that's why we do science. That's why we do studies and look, and we'll continue to look to see what we can find, and perhaps we can find a combination that will work and will bring us on board. So I see you're practicing the pediatrics part of your family medicine training there, Theo. That's awesome.
Yeah, this is Ezekiel's running around here, not quite clothed, and yeah, you never know what's going to happen in the Hensley household here. So,
that's right.
Yeah, that's something for you all just to hear it a second time. Is in medicine, these are the kind of conversations we have. We talk about what we know, what we read, and then, of course, the most important thing of medicine is it reproducible, right? If someone in Sweden or France has a finding of a benefit for a certain medication, then can we reproduce it? And then, of course, the next question is, what kind of genetics do those people have? And is it similar to ours? And, because some people may respond better than others, but that's how that conversation goes in medicine amongst doctors. We don't care about the politics. I don't care if Trump is right or wrong about this. I want what's best for the patient. So great question. A lot we still don't know, but I echo, the dexamethasone or the steroids for the most sick of patients seems to make a big deal. The blood thinners makes a big deal. Supplementum oxygen, turning people on their stomachs, all those is the best treatment we have, but there is no silver bullet at this point. The best treatment is prevention. Okay. Julia Morgan Linebacker, if I pronounce that correctly, says, what is the first step you would take if you were to start to experience symptoms? Danny, I'm going to let you answer that one because you are the expert in this one.
Well, again, I think if you begin to experience symptoms at this point, the two things I would suggest is, number one, get a test so that you know there's a possibility. In this local area, you can call the Nurse Connect line and get a test. Anyone can be tested through your local health department here in Greene County. Tests are fairly widely accessible at this point. You can see your physician and get a test as well. We can order those as well. There's really no excuse not to get a test. But beyond that, the next thing I would say is once you get the test, isolate yourself as much as you can. And stay inside and stay away from crowds of people until you get your results. If you're negative, then praise God, you spent a few days where you weren't exposed to a lot of people and you didn't spread the disease. If you turn out to be positive, then you've lowered the risk for everyone else you expose yourself to. One of my biggest fears when I found out I had the disease was spreading it to my family. And so I isolated myself in my basement and stayed away, and praise God, that I saw the text when I was on day 14 or so hospitalization to say, it's been 17 days since Danny's been away from us, and thankfully none of us are sick. And, that just made my heart leap of joy. So, number one, if you have questions and issues, get away from everybody as best you can until you get a test. Stay inside while you're waiting for the results of the test, and then based on the test, if you have it, stay away again for up to 14 days and isolate yourself to limit the spread to others. That's what's going to get this virus under control.
Yeah, echo that completely, because this, I feel like it's simple, but I really need to stress how important this is. I literally had a patient show up to my office on a Monday morning a couple months ago saying, hey, the health department swabbed me on Friday, and I haven't gotten my results back yet. And of course, my eyes got real big. Okay. And then here we are back in the basement again, honey. I can't come upstairs tonight. But just to come in for medicine refills. So if you're out there and you have some symptoms or you've been swabbed, yes, if it's an emergency and you're dying or near dying, yes, you need to go to the hospital, but call your physician's office before just showing up. But also don't go out and expose people, right? There's been a few concerning things I've seen in the media. There's students apparently somewhere down in Alabama, I'm not sure which school or college, I haven't read that full article, where they were trying to get people sick and they were taking bets to see who could get it first and things like that. There was some rumor mill going on here in Greene County last week that someone was at a yard sale and said that they had tested positive for corona and they were going to go around and intentionally spread it and whatever else. And my comment on that was, you need to treat the environment as if there is someone going around intentionally spreading it. So that shouldn't change your behavior there. I have no idea why someone would want this, but yes, it's not a good idea to have a COVID party to get this naturally. Either wait for it to die out or hopefully we get a vaccine on that. But don't be sure.
I talked to a patient, and I talked to an individual in this community, a patient who had the virus, and they were concerned enough to get tested on Thursday, but weren't concerned enough not to go to work on Friday. And their results came back on Monday positive. Well, but I really didn't think I had it. If you're suspicious enough to get tested, please isolate yourself as much as possible so you can get that result. He did the very right thing. He said, I just thought I was being responsible by getting tested. And he was, but he needed to stay away until he got his result back as well.
So you hear that? I'm going to say it clearly into the microphone. Stay home if you have been swabbed and don't know if your test is positive or negative. Okay. Really?
Other than that rare exception where you have to go to the hospital.
Yes.
The hospitals are ready for you. But please notify them as much as you can and let them know ahead of time.
Absolutely. Yeah. And that's a great point too, Danny. Thanks for reminding me of that. I'd mentioned that on a previous video, but we need to remind people everything we can. I've specifically spoken with some of our local great ER docs, and that's what they said is they have a protocol. They have a way to isolate someone to go ahead and get them back into a room so that then they're not exposing other people in the waiting room. So if you are confirmed, if you can, go ahead and call the hospital, or I guess would they call 911, Danny, or just the hospital directly and speak with the operator, or how would that work?
Well, 911 has protocols to account for people that they're exposed to we call it a code airway, so that they're prepped and they can help isolate them. Again, you can call the emergency room and let them know that you're coming in. The main hospital number you can hit 4 and go straight to the emergency room to get a hold of the triage person and let them know. Or even just cover your face and come to triage and let them know, hey, I've been tested for COVID, or I'm COVID positive, but I'm having issues. And we'll very rapidly get you to a point where we can isolate you. We don't want anyone not to seek care that they may need. We have seen, tragically, we did see deaths go up for non-accountable reasons as COVID kind of came out in the first wave. People staying home with heart attacks or other issues because they were afraid of the hospitals. Don't be afraid to seek out the care that you need. Come get the care that you need. But just be diligent and let people know as early and as quickly as you can that something's going on so that we can limit exposures for you and for others.
Incredibly important point, and you guys need to hear that one too. I'll speak into the microphone on that one too, right? Do not ignore your high blood pressure, heart disease, or diabetes. It's really, really important to address those things. And so when I say, hey, it's important to still follow up with your doctor, we're taking lots of steps. Yes, my business does partially depend on seeing patients. So that is a conflict of interest. But we know that uncontrolled diabetes, uncontrolled hypertension, other types of chronic diseases are at incredibly high risk just of themselves of complications of coronavirus. But also, if your sugars are running really high and you get this, that's bad. Your immune system will not like that. So it's really important to treat diabetes under guidance of your doctor right now and to be following up. And if you are having emergent symptoms, to seek out care. I did a televisit with a patient that is highly intelligent a couple months ago, but was having somewhat concerning chest pain symptoms and refused to come in to see me, refused to go to the ER. Now, that person turned out to be okay, thankfully. But what I told them was, you're more likely to die from this heart attack right now than from going into the ER, seeking care that you need, and somehow contracting coronavirus in that process. So really important to still take care of yourselves out there. You need to be exercising. You need to be hopefully eating right and losing weight. I'm working on it myself because let's just be blunt. Us fat guys and girls, we're at higher risk of this too. That's a huge risk that we all need to be aware of. So we need to be taking care of ourselves and working on our general health.
Absolutely. The two biggest risks it turns out that I had was a little bit of blood pressure, hypertension, and obesity. And they both bit me pretty hard. The COVID helped me with the obesity piece a little bit. I lost up 40 pounds while I was in the hospital, but I don't think I'm going to recommend that to Jenny Craig or anybody else with a viral plan, I tell you.
I kind of always have that kind of joke the same way too. Every time I get a stomach bug was, okay, I'm down 5 pounds, might as well work on more now. But no, you
not this way.
No,
not this way.
Absolutely not. All right. Tanya Parkins says, I was around a family member this past Saturday that tested positive for COVID. I'm a type 1 diabetic. My doctor's office is closed today. So is my endocrinologist. I just found out today. Am I okay to wait until Monday to get tested? Tanya, if you're feeling okay, I wouldn't go anywhere. I would treat yourself as if you have the virus. Stay home. Don't expose other people if you can avoid it. If other people live in your house, try to even isolate them on the other side of the house and pretend or act like you do have it. Don't do anything different from that perspective other than avoiding people. As of right now, there's not any proven things that you would need to do. Now, I don't know what your thoughts are on vitamins and supplements, Danny. I'm not a big supplement guy in general, but I have seen enough studies in the past with common colds with vitamin C and zinc that, I myself do take a little bit of that right now just because I don't eat a lot of citrus. And so, your immune system does rely on those things. There's not a lot of evidence for it. Some evidence in common cold say that you can maybe decrease sickness time by upwards of 10 to 12% if you drink some orange juice during a viral infection or something like that, for example. Same with zinc lozenges like Zicam. There's some benefit, probably not a whole lot of harm. So that's something to consider. But I hate even saying that because, like I said, I'm not a supplement person, but there is literature out there saying some benefit with no risk. So I don't know if you have any thoughts on that from a medical perspective.
Ditto. The advice is the same. I would, as long as you feel well, stay inside. I don't think I'm not a huge supplement guy either, but I don't think a little vitamin C and or zinc is going to hurt you at this point. So it's reasonable. Just make sure you follow the directions of the package and don't take it in super high doses.
Good point. Julian Lineback says, I know that you are both men of faith. How do you think your faith has improved your outlook during this challenging time? We might have different answers to this one, but what an interesting question. I wasn't anticipating that. I've gone through fear, anxiety, depression. I felt at peace a couple of times, but I'm struggling praying to God, hey, where you at, big guy? We kind of need you here. We're starting back our church right now, and I played in my church band a couple times, led worship service at one location last week. And, I'm just cringing seeing everybody talking in close contact without masks. We are starting wearing masks for singing this week, but, I have faith and trust, but I'm still nervous. How are you doing?
Well, Julia, it's a great question. And, I've been pretty open to my postings and things is that I feel, given the illness and things I went through, I feel very confident that a large part of the reason why I'm still here is because of God and his goodness to me and the people he put in my path to protect me and those that prayed and for me and thought about me routinely. I feel that made a big difference. That doesn't mean there's still not times of fear and trepidation. God promises that he will be with us. And I felt his presence multiple times when I was in the hospital. I've related that the morning I went on the ventilator was probably one of the more calm times that I had the entire time I was there because God just sat with me and held my hand and kept me close. I wasn't always that way. There were times that I had doubt and disappointment and fears and things that developed. When I found out I had a blood clot, I had a full-fledged panic attack and freaked out. And, just because of the fear and the factors and probably knowing more than I wished I had at that point. But, it has certainly strengthened my faith. My experience in general has tried to lead me to make sure I prioritize my life properly. There are times that my priorities will get out of sync. And, I love my work. I love what I do as a physician. And it's important work, but it's a part of me and it's not all of me. And at times I've let that be more than I probably should. And so I'm certainly working towards the work-life balance and balancing the faith is part of that as well. But, there will be fears and trepidations and things. And I've had my points when I see Florida going up by 10,000 a day, I start to freak out a little bit and say, here we go again, because I don't want this a second time, for sure. And so, but I do think I have grown. I think God is very important, and he continues to be very important to me in that regard. But it's okay to have some concerns and faith that God wants us to turn to him those times and to have that. And I would just say that seek him out and pray to him and let him know your honest feelings, and he'll work with us best he can. But we can also, I think, do things that can help us potentially try to lower the spread of this virus as well. So.
Yeah, and I'd like to follow that up with, first of all, thank you for your testimony and sharing, obviously. Science explains the how of what is going on, but not that why of things going on. And, there's always been bad things going on in the world. There's always been plagues. From a faith perspective, I think it's just important to trust that God will get us through this, but also to not be, how can I say this, not to be reckless in our decisions, right? Just because God will get us through certain things doesn't mean we should drive 100 miles an hour without a seatbelt on in the rain, right?
Amen.
So,
yeah, okay. Theo, you've probably seen that meme, or Dr. Hensley, you've probably seen that meme going around of Jesus knocking on the door. It says, hey, Betty, I need you to take your diabetes and your blood pressure medicines, okay? I helped develop these for a reason so that you have them available. You can rely on me, but use the tools and things that are given you as well to make that, to give you some protection in that regard. So I agree. Don't drive without a seatbelt in the rain, and continue to take your medicine, seek out the care that's there.
Well, very good. So what I'd like to do, we've just got a couple last questions here and comments. And by the way, Mary Watts, I guess you had followed up a couple comments there. One was that Kingsport had one patient that was a pediatric patient. We're watching that kind of information, and nationwide, luckily it's not affecting kids as much, but there will be kids that will be affected by this, and unfortunately eventually could be some that demise from this. There's about 100 to 120 kids every year that die from flu, and that's why I push the flu shot so much, is because I don't want these 100 kids to die every year from flu. I would like to save them, and the old and the frail people and all that kind of stuff too. But for some reason, it affects some people more than others, and some people maybe have underlying conditions they don't even know about. So, early on, we were told that kids weren't necessarily a vector for this, but I have kids that are snotty all the time and fevers, and they can transmit everything else. So I never saw anything of why that couldn't there. She also followed up and said, I guess, about the losartan blood pressure medicine that has taken for years. I've seen a few trials going on with losartan. Initially, in medical world, the things that I was watching was, you should avoid some of those medicines early on because they could make it worse. And then all of a sudden they kind of backtracked on that, and the science said, actually, no, it doesn't matter. Now they're actually looking at these medications to see if they make a difference. Same goes with some acid reflux medicines that I won't mention, other types of things out there that shouldn't actually have anything to do with anything. The blood pressure medicines maybe just because they affect some of the enzymes in the lung. But there's just so much of that we don't know yet. So I think it's inappropriate to announce anything or say anything from that perspective on those. And I guess they were also just asking in general. So hopefully, both in pregnant and non-pregnant, hopefully we address those here as well. Terry Rendrup says, how many cases are there in Greene County now? Like I said, I saw the total just a little while ago of 95. I haven't done the math of recovered and deceased to be able to give the active, but off the top of my head, I'm guessing that means probably about 35. Danny, are you?
I think we were at 56 recovered was the last I saw, so that doesn't count for the 2 deaths. So yeah, we're up to about 40 active cases, probably 30 to 40 at this point.
Yeah, and of course, obviously there's more than that, because there's people that haven't been diagnosed yet, or people that haven't been swabbed, or whatever else, or people that are asymptomatic. So once again, don't be panicked, but you need to be prepared. Okay, you don't need to be gathering in large groups indoors right now. If you can be outdoors, do so. I posted a picture myself at Aunt B's this morning. My kids wanted some pancakes, and well, I wanted some pancakes too. So we went to Aunt B's. We sat outside on picnic tables, and it was a beautiful morning. And we have fresh air, and that's overall pretty low risk, right? So anytime that you can be smart, interact, patronize our local businesses and those types of things, use takeout, whatever we need to do, but you really need to be cautious, especially if you're old, medically frail, just about take any medicines for anything hardly, but especially blood pressure, diabetes, or any kind of lung problems, then you probably need to avoid the large crowds and consolidate shopping trips to maybe one trip a week, or try to get more things at once, go to one store instead of two, wear a mask, wash your hands, and all those types of things. Let's see, Julie Blakeney says, it's so wonderful to have local caring physicians take the time explaining things about the virus that has disrupted everyone's lives. Thank you so much. You're welcome, Julie. I'm sure Danny can attest to this.
Absolutely, thank you.
The vast majority of us physicians, even if we're sometimes grumpy or short, or some people that have different personalities, or really good senses of humor or bad senses of humor, the vast majority of us got into this profession. Why? Because we want to help people. Isn't that the response? Isn't, when you applied to medical school, isn't that what you wrote on your application? You want to help
Absolutely.
people?
Multiple times.
Yeah, so you didn't write, hey, I want to make a lot of money and go into hundreds of thousands of dollars in debt, and I pull my hair out when people argue with me on Facebook about mask use and things like that. That's not why you went into medicine?
Neither one of us has a whole lot of hair on top left anymore. Maybe I preserved it if I had.
Yeah, all right, pulling it out here, exactly. So yeah, absolutely. That's why I started the Dr. Theo Show, and our updates here on Facebook and YouTube was people were distrustful of information because of certain news networks or whatever else like that. And what better way to get information than people that you know and hopefully trust? Not that we're perfect, not that we know everything, because we don't. In fact, the more I read and the more I learn, the more I realize I can't know everything. And if I can't know everything, you can't know everything either. So we're providing the best information we can, and that'll change, but we'll try to keep you updated. And who knows, Danny, maybe I'll have you on the show again sometime. You're welcome anytime for that matter. All right.
Absolutely.
Last few things there. A few more thank yous. Dr. Daniel Lewis rocks! ! Great to see you, my friend. That's from Dr. Mike Sevilla. Oh, hey, Mike. Yeah.
Mike.
Let's see. And Carol Vest, thank you very much. Love to you both. Okay, that's the comments. Any lasting thoughts or things that you want to say to our community or anyone else out there in Facebook or YouTube land?
Well, Dr. Hensley, like I said, I just want to reiterate again how appreciative I am that you've been willing to take up this banner and this flag, and really have been trying to be the voice of reason within our community during this time. And I'm glad to try to assist however I can, but you're doing a fantastic job. And I know you were carrying this banner and this staunch alone by yourself for quite a while. So again, just very thankful. I'm so pleased that you're in our community. You're part of the medical team here around to support. Greenville's blessed to have you. And I'm so thankful for the opportunity, for all that you do. Thankful for the opportunity to be here, and we can chat again at some point. I'd be more than happy to come back on if you'd have me, and we can talk some more at some point if need be. And but again, I'm so thankful for you and for all that you do, and I'm blessed and honored to call you a friend and a colleague. So thanks for everything.
I'm blushing over here, Danny.
That doesn't happen often.
Yeah, you're right. It's I think one of the hard things that I've had over time is taking a compliment, because I always kind of want to like, oh no, it's not that big of a deal, but yeah, actually it is kind of a big of a deal. And I'm not saying that for me, but thank you for thanking me, and thank you the community for thanking us both. I promise we care. Now, usually I close out the show with my new catchphrase, 6 feet apart or 6 feet under. The choice is yours. And I also try to dab cough and dab sneeze in every video. So there you go. There it is. So now that we've gotten those out of the way, I'd like to close this interview a little bit differently, especially with our conversation of faith that we had. And that's something probably we need more than anything else, which would be just a moment of prayer. I'm sure you're okay with that there, Danny, right?
Yes, sir. I'm fine.
All right. Dear Lord, we come to you broken and scared, not knowing who to trust, which information is best. We come to you in a time of political unrest and racial tensions and societal boiling points. And we ask you, Lord, to calm our hearts and calm our minds of all these awful things going on in the world. And for those of us that need some softening of our hearts, myself included, we ask you to please do that, Lord, and to provide your healing grace to all those affected right now by coronavirus and all other medical illness. For the people going through cancer treatments that are absolutely terrified right now, for the people having heart attacks and going to the hospital for all the other reasons that they are normally, for the fantastic nurses and physicians and respiratory therapists and physical therapists and all other allied health that are putting their lives on the line, literally, for the helping of others. Lord, may you help us to accept good advice and discern the truth which only you can provide, dear Lord. We thank you for blessings. We thank you for breathing. We thank you for my friend Danny here and him being alive to testify and to spread your word and medical truth the best that he can, Lord. And we ask you to fill our lungs and our lips with grace and humility. In your name we pray. Amen.
Amen. Thank you for that, and thank you for everything you do.
Danny, I appreciate you being on. You have a good evening, and happy 4th of July to you. And if you have any more information or anything that you think that I need to know, let's team up. And you know what? I think we should challenge I don't know, some other doctors in this community maybe to come on this show. Maybe they could join us both or just me. Because I don't know, man. I mean, do you have any other ideas of how to reach out to our community? Because we can't fix New York. We can't fix Texas. Can we, who do we want to challenge maybe to speak on behalf of those of us in the medical profession? Do you have any ideas, any names just off the top of your head?
Not off the top of my head, but I think we've got some good folks that work in our hospitals and things we both know that we could possibly get involved and could bring on some perspective for us. So let's work on that and see if we can't do that together. Okay.
Okay. I put you on the spot and you gave me a very politically correct answer, because I would name names. I would call people out and it's like, hey, Dr. You're next. I challenge you, right?
Yeah.
And then we have some kind of ice bucket we dump on our head or something. I mean, you know, how can we docs go viral with some kind of challenge to challenge another doc to speak out for medical truth? Well, that's going to be the challenge. If any of my other physician friends would like this kind of opportunity to reach out to me, because I don't want this to be just my voice. I need a whole army of really smart, educated, concerning people. And I have invited at least one physician who doesn't think coronavirus is all that concerning, and hopefully he would check this video out, and Dr. Lewis's testimonies know otherwise. But I'm not looking for one narrative. I'm looking for a group of smart people to get information to our community. So thank you all very much, and thanks for tuning in. Happy 4th of July.
Thanks, guys.
All right, let me pause stream. Okay, Facebook video is now ended. We're stopping streaming there. And